There we go. Thank you very much. Over to you.
Thank you so much. Good afternoon, everyone. It's a balmy, rainy day here and cold day here in Stellenbosch. I hope it's a little bit warmer where you are. Thanks for coming to spend a good part of an hour or two with us. I'm going to speak to you about why I think we should all know data science and how data science is quite important for us in Africa for our development. So let me start by just giving an introduction to how data science has been used, in various scenarios in the recent past. And then I'll talk about the school and various opportunities for data science, for collaboration, etc. Right. So let me move my slide. So as Corina mentioned, I joined Stellenbosch University at the beginning of last year. And since then, we've made quite a lot of progress at the school. But for me to introduce to you, the school and why data science, I really shouldn't talk about the fourth industrial revolution. So we are creating more data now than we ever have in the history of this world, right? I think in 2017 or something like that, Forbes published an article that said we had created more data in the prior 2 years than ever prior to those 2 years in the history of the world. And this data generation is coming through everywhere. It's coming when we chat on the Zoom call. So what's being recorded onto the servers is data. There is data when we make a phone call. There's data when there is a security camera that takes a picture of us. There's data generated when we wear a watch that tells us how many kilometers we've walked. And there's data generated when we go to a doctor and the doctor stores our health information on their files. So there's multiple different avenues of generating data, and so this data it can be used to improve the quality of life in the long term, whether at the individual level or at a group level. So we're entering a world where we need to think about data, both the generation, the storage, and the analysis of data to improve quality of life. And so a good example that came up out in the recent year is how data was used in COVID-19 in various ways, from analysis of COVID-19 to the discovery of COVID-19, etc. So there's multiple different application of data science and artificial intelligence as COVID-19 started taking a hold in the world. And then, of course, I'll introduce the school a little bit more, and then I'll talk about opportunities. Cool. So the first thing I have to do is, define data science, right? So at the university, when we launched the School for Data Science, we decided that the School for Data Science and Computational Thinking, we decided the broad definition would be anything to do with data, right? So it could be analytics, machine learning, artificial intelligence, predictive analytics, etc. We don't have a narrow definition for data science at the university. And the reason for this broad definition is so that we can use the expertise that are found with everybody who uses data to collaborate and build better outcomes, whether it's outcomes in research, outcomes in agriculture, outcomes in medicine, etc. So the definition is wide. Secondly, as I will talk about later, we are not just a school for data science, as you'd see at many other higher education institutions. We are the School for Data Science and Computational Thinking, and I'll explain that later. And for short, we call ourselves the Data School because we are anything to do with data. And if you think about data in a broad sense, or data science in a broad sense, you think of the science of data science and then the application of data science. And what you find is that both of these are found at the institution. And so the way the school has been designed is to bring these two factors together, both the science of data science and the application of data science. Right. So what I want to launch into is what's happened in the recent past and how data and data science have been used with things to do with COVID-19, from discovery of COVID-19 to analysis, testing, diagnostics, drug discovery, etc. And when I look at how data science and artificial intelligence has been used in, with related to COVID-19, it really is interesting the kind of things that we can do with data science to improve the quality of life for citizens across the world. And given that data science doesn't require, a large machinery, it requires, just human capacity and a computer, we are able to build a better world here in Africa without large investments. The investment has to be in human capacity building. So I want to use COVID-19 as a way to introduce how data could be useful to us. So I don't know if you guys remember back in, early 2020, COVID-19 was the buzzword and we were scared about lockdown. And in South Africa, we went into a long, hard lockdown at the end of April. And for people in other countries, the lockdown varied in somewhat, but outside of Sweden, there was definitely a lockdown. And in fact, Sweden went into a lockdown later as well, as far as I understand. But before all this, they discovered COVID-19, they discovered this virus. So how did they discover this? One was through, World Health Organization sending in people and talking to doctors in China. But before the World Health Organization released their report of this new virus, there was actually a private company that came out and said there is a new, disease, pneumonia-like disease happening in around a marketplace in China. And so how did they discover this? So this company, Blue Dot, is a company that uses data to analyze various, early warning systems. Oh, it is an early warning system. And it was founded by a person called Kamran Khan. He's an assistant or associate professor at University of Toronto, and he had been working at Columbia University prior to founding Blue Dot. And he had access to a lot of travel or airline information, things like where are the airlines flying to and seating information within the aircraft. And he thought this information can reveal a lot of other information about flights and about people, etc. And he's an epidemiologist, so he was also interested in how diseases are spread. So when he went back to Toronto around the time when MERS virus or the SARS virus was getting a foothold, he thought, well, if you analyze airline data, you can figure out how diseases spread across the world. Because how do diseases spread? Well, disease might take a stronghold in a city, and then people fly from that city or travel from that city to other cities, across to other countries, and then you get viruses taking hold in other countries. And so with his interest and his expertise in epidemiology, he launched Blue Dot. And because it was launched around when SARS or MERS was taking a foothold back in the early 2010s, the early warning systems for health, early warning systems was really the place he was focusing on. And so he developed this engine that analyzes a whole lot of articles, 100,000 articles in various languages, to look at if there's any patterns that are emerging out of these articles. And these articles are, range from normal newspaper articles to reports that agricultural organizations and the World Health and the health organizations release. So it tells you some information about whether there's a disease among animals, and then it also tells you if there's a corresponding disease or diseases that are emerging in humans. And so around December of 2019, they realized there was a bit of chatter around Wuhan in China, around the marketplace in Wuhan in China, on a pneumonia-like disease. And so using his engine, they realized, oh, something is emerging out there. And they warned their clients about this emergence of this disease. And they, in fact, warned their clients a week before the World Health Organization had done that. And how do they do it? They use artificial intelligence to analyze data, to look at various natural language processing, in other words, looking at words and looking at trends to figure out if there's a common theme that are occurring. And what this blue dot engine does is looks at the top 5 emergent stories of any time, and then they look further into these top 5. Of course, there's multiple emergent stories, much more than 5, right? But they still need humans to go and then analyze it further. But it cuts down on the amount of analysis humans have to do by by ranking the top 5 for humans or the analysts to look at, right? And so this engine analyzes every 5 minutes, every 15 minutes, and it analyzes 100,000 articles in 65 languages. So you can imagine the power of this engine that could predict COVID-19 and tell to their clients prior to the World Health Organization had released their report. Right? So that's an example of how artificial intelligence was used in discovery of COVID-19. At the same time, last year or subsequent to that last year, when COVID-19 started taking a foothold in South Africa, there was a lot of articles on COVID-19. And so what we did at the school, both I and the vice rector of the university, Professor Eugene Flutter, we started releasing these exploratory analytics articles on COVID-19. So these articles were not meant to be deep scientific articles, but analyzing the data to look at trends. And by looking at trends, you could figure out that people with comorbidities or with other diseases, for example, had a greater propensity to die from COVID-19 than those without. And certain comorbidities were worse off than others. For example, obesity, cardiometabolic diseases, and I think it was diabetes that were considered to be the worst of the comorbidities. And so then it would take, such information was useful for people suffering from such comorbidities, because then they can take extra care around themselves so they do not contract COVID-19. And by looking at the data, you could also see that COVID-19 disproportionately affected older population than younger population. And from that analysis that was done by various research groups, you could see that was fed into the government's vaccination plan, where you see that they're vaccinating people over the age of 18 first, in fact, over the age of 70 in the second round, and then people with comorbidities, but younger as well, and then only people who are above 18 without comorbidities. And so it's these kind of analysis that looked at historical data that tells us something about COVID-19 and allows us to create policies around COVID-19. Here's a graph that told us something about Gauteng and KwaZulu-Natal, which are 2 provinces in South Africa. So on the x-axis is number of weeks since the highest point of infections, and on the y-axis the number of infections. And from what you see in this graph is that Gauteng had a higher number of infections than KwaZulu-Natal, but the trend clearly seemed to show that Gauteng's new infections were decreasing faster than KwaZulu-Natal. And so that allows us to then dig deeper into why that's the case in KwaZulu-Natal, and perhaps implement similar kind of strategies why that's the case in Gauteng, and implement similar strategies in KwaZulu-Natal. And so what we had done was to publish about 10 news articles on Netwerk24, which told us something about COVID-19 and how it was spreading. And it was used to spread the word to non-specialist readers. And in fact, we had feedback from people who came back and said, well, without this article, I wouldn't have known I had a higher propensity to get COVID-19 or to get sick from COVID-19, so I had to be careful. And of course, there were lots of people writing these kind of articles, which was useful. I'm just going to the next slide. Then in terms of testing, when COVID-19 started taking a foothold, they had to develop tests to to figure out if somebody had been infected with COVID-19. And generally, it takes about 2 to 3 months to create these test kits. But in South Korea, where COVID-19 was pretty bad initially, a company called Seegene developed a test kits within 3 weeks. So how did they do that? The World Health Organization had sent out, shared the blueprint of the genes of the virus, or the genetic code of the virus. And what Seegene did was took the genetic code and used artificial intelligence and a supercomputer to design a test. And once you design a test that would work on the virus, then you can test it out in real life, or construct it, construct it and test it in real life. And so that cut down the development of the test kits from 2 to 3 months to 3 weeks. And you can imagine how urgent it was at that time when, people were getting sick in China, people were getting sick in South Korea. South Korea was one of the badly hit countries at that point, when some people had come back from China to South Korea and then had spread it within one of the cities there. And then from that point, it started spreading quite badly in South Korea. But they brought it down quite quickly because they were able to test and put in interventions for people who may have been infected. So this is another example where artificial intelligence and using a supercomputer, so high computing power, they were able to design something as practical as a test to be used for COVID-19. Then, of course, diagnosing people, right? So initially, there wasn't tests to go around. And in big cities, you could obviously get CT scan. And so in this article that was published in Nature journal, researchers used a CT scan of patients, as well as other non-image information like travel information, other clinical information, to put it into various data science and machine learning models to figure out the probability of somebody having been infected with the virus. Now, if you think about a normal test kit where you prick a person's finger and you put the blood on the test kit as an example, or you take a swab of somebody's throat, what the test kit tells you is whether you're infected or not. And when it tells you that you're infected, what it means is that if there's a probability that you're infected. There's of course a chance that the test kit would show that you're infected, but you're actually not infected. And there's a small probability that you are not infected and, you are infected and the test kit says you're not infected. So what they look for is a test kit that is highly accurate, that tells you when you are infected and tells you that when you are not infected. And as test kits improve, that's what they try to improve on. But before they had developed the test kits, especially in countries that didn't have access to the initial test kits, then where there were CT scans, you could incorporate it with other information, and that would tell you some probability about the person, or about the person having infected with the virus or not. And in this example, what they did was, they put the person through a neural network, which is a type of a model, including the CT scan, and that would tell you some probability. Then the second one, which is the machine learning model, that would tell you a probability. But the best model was when you incorporated all the data, so the CT scan as well as non-image information, to work out the probability of the person being infected. And of course, this is an example where the more relevant data you add, the better is the accuracy, or the higher the accuracy of predicting whether of your outcome, in this case, whether the person has, or the patient or the candidate has COVID or not. And this was really useful because CT scan is available in large cities, even though they're quite expensive to use. And with that, you could use non-image information. And in fact, if you use CT scan by itself, they showed that experts who look at CT scans did not predict whether whether a candidate individual had COVID-19, as well as the data science machine learning models, right? So in other words, the models did better than experts who had been looking at images all their life. So that's quite interesting in itself. And then here's another example of diagnostics. This company, developed a tool where you input your information and it would tell you what your vulnerability is to COVID-19. So, for example, if I'm diabetic and I input the fact that I'm diabetic, that I travel a lot, I have a job that where I have to meet a large number of people, then it would tell me what is my chance of getting COVID-19 over and above like a standard case, and so this would tell me, for example, I could then work out whether I needed to reduce my vulnerability or not, particularly given the controls that are given factors that I cannot change. So I cannot change the fact I am diabetic, right? But I can control whether I go out into large gatherings or not. And so you can work out your vulnerability, whether it increases, how much it increases as a result of certain action or certain control points. And so that is quite useful for lots of people when they want to affect behavior, right? And the way they developed this tool was look at historical data, look at people who gathered a lot, who did not gather in large groups, looked at people who had diabetes, who didn't have diabetes, etc., and worked out the chance of somebody getting COVID-19 or not based on historical information. And then you can input new person's information and work out the chance of the new person getting the virus or not. Of course, you all may have seen this, right? Chatbots, right? So I know with some of the companies that I deal with, it could be your health insurance companies, it could be your gym contracting companies, where there's a chatbot that tells you, something about COVID-19, and so you could those chatbots would help you screen. It will help you. It will give you lockdown information or other health-related information, COVID-19 or non-COVID-19 related information, using these chatbots. And these were convenient ways of getting information out to the public, right? Because I did not have to have a doctor telling me, large mass of information anymore. I could just ask a chatbot some information, and the chatbot could tell me such information. And here's an example on the right-hand side of Penn Medicine, which is a company in Pennsylvania, and this chatbot, which will tell you, you could ask it some questions, and it will tell you the answers to that question. Of course, if it can't give you an answer, it might direct you then to a human agent who will be able to give you answers. But this, this kind of setup reduces the cost of diagnosis and cost of screening, because it allows you to use the computer rather than humans, and it also allows you to get to many more people than if you had to have one-on-one meeting between a screener and a patient. Right? And I'm sure lots of people would have come across such kind of bot or used such kind of bot in other scenarios. Right? So COVID-19 was also used in helping to discover drugs for COVID-19. Sorry, I said that wrong. Artificial intelligence and data science was used for drug discovery for COVID-19. So historically, medicine was designed and produced by using in vitro, right? So in a lab, in test tubes. And then you might test it out in a living organism, whether it's a mammalian organism, and then you might try it on humans, as you do with testing of vaccines in multiple trials. What they do now is they design drugs using in silico, which is using computational power. So what they can do is they can look at historical medication that already exists and see which of these drugs candidates could be useful in fighting COVID-19 or fighting a particular disease. So in other words, they consider the suitability of existing drugs in the fight against COVID-19 or for any diseases. And therefore, you can take the multitude amount of drugs that exist out there and cut it down to a feasible number of testable drugs, which you can then test it on either animals or on humans, and therefore speed up drug discovery faster. So this, this article came out in 2017 before COVID-19 was found, but AI has definitely been used in fighting or in drug discovery for COVID-19. And in fact, in vaccine development as well, because when you design when you design a vaccine, you have to understand the genome of the virus, and so they use computational power to see what kind of properties in the vaccination would help in fighting COVID-19. Right. So those are multiple examples of how data science and artificial intelligence has been used in medicine and health science in the recent past. And so you can see how, there is potential for us to use data science to improve quality of life, at least in the health sphere here in Africa, right? I mean, when the whole COVID-19 case started, we did not have access to test kits initially, at least here in South Africa. I think Senegal, or one of those countries in West Africa, developed their test kits and process quite quickly, but the rest of Africa didn't. And so we need to develop capacity here where we can use AI and data science in helping to fight against diseases, so in health, in water and energy, in agriculture and food security, in climate. And there's examples of how data science can be used in all these application areas to improve quality of life on this continent. So I want to take you through this example of water and energy, agriculture and food security and climate. Right? But first with health. Right? So what we have in Africa is we have a large rural population who don't have access to big fancy hospitals. So we need to be able to take healthcare to them. And one way to do that is through remote medicine, where we can use various remote methods to be able to take medical advising or consultation to patients in rural areas. That way, we don't have to have experts everywhere, right? Also, if you think about it differently, I mean, for those of you who know Stellenbosch University, you'd know that we have lots of experts, medical and clinical experts here at the university, right? There are other experts that we don't have, for example, in Uganda, right? Using remote medicine, we can share our knowledge and our expertise across borders and across regions, inside a country and outside the country, right? And so this, the connectivity allows us to be able to share information and expertise easier. Another example of this is if you think about rural areas where they don't have access to the latest equipment, right? So I have a colleague who had some shoulder difficulties. So he went to his doctor I presume in a small town. They took some x-rays, right? They fed the x-ray information to a machine learning system, and then they went for coffee. And the machine learning system will then output whether the person has a problem or the person has nothing to worry about, or maybe you need to dig a little bit deeper, right? So imagine now somebody living in, let's say, Lusigi in the Eastern Cape, which is a rural town. I used to live there. That doesn't have access to the kind of machinery we have at, let's say, Tygerberg Hospital in Bellville in Cape Town. Then we could use X-ray machines, which they would have in Lusigi, as well as a computer to figure out if the person should go into a bigger city to get more better care or not, or whether they can provide the care in a local town without the big machines and expertise. And so that becomes useful in terms of saving time and taking medicine and healthcare to people in rural areas, right? And AI and data science could help with that. Secondly, precision medicine is becoming big across the world. So precision medicine is where you look at each individual situation from, let's say, genetics of the person, their environment, their activities, etc., to figure out intervention for that person. So in other words, you and I could be exhibiting the same symptoms for the same diseases, but we might have different intervention based on our activity levels, our genetic code, etc. And so by taking precision medicine to our patients, we are able to improve their quality of life by targeting each patient to their needs rather than develop intervention that covers a large group of people. Right? So these are examples where I think South Africa and Africa could be at the forefront of taking healthcare to the rest of the continent and to the rest of the world, right? There's no reason why South Africa or Africa in general cannot lead in that. There is a part that I didn't mention here, which I think is very important, is the ethics of health and medicine, right? Especially with AI and data science. So how we use the data science, how we use data science and artificial intelligence using private data to come up with health outcomes or interventions, to come up with interventions for health outcomes. At the moment, this is I think of it as a developing field, and we could be leaders in Africa on thinking about ethics of AI and data science in health and medicine. There are other areas which I think are quite important for data, where we can use data science in non-health world. That's in water and energy. So if you think about water, we don't, in the Western Cape, the province where I live, where Stellenbosch University is located, for those of you who are not from South Africa, there was a shortage of water in the past few years. And so it was really important for us to map the amount of water that exists in the province so we can utilize water better. And one way to do that is, taking satellite imagery and letting machines figure out use computational power to figure out the amount of groundwater that exists in the province. So mapping is really important. And another example where this is used is mapping forestry, which I'll talk about later. Then, of course, usage, right? So as you figure out the usage in various population or various areas, then you can put in intervention for either more efficient usage or to reduce usage where necessary. So a good example of this was to look at the data that was generated by usage by small geographical groupings in Cape Town, in the city. And then you could put an intervention like showcasing which small blocks is using a lot of water. And therefore, you might find through behavioral economics that people will reduce the amount of water that they use based on what others are using and seeing that they use more than other people. Of course, data science and artificial intelligence is used in sewage. So if you look at sewage and effluents, and if you analyze the data that comes out of testing the effluents and sewage, you can figure out if there's high drug usage in certain areas or not, right? And that data is quite useful in putting in policy information, policy intervention for drugs, etc. Right? So if you would excuse me for 1 second, I just want to connect my battery because my battery is dying. Sorry about that. Okay, so that was for water and so sewage. You could use that to analyze sewage data to figure out whether there is a recreational drug problem in certain areas or not. And of course, we need to use data science and artificial intelligence in the operations of water and energy, right? So we know that there's a loss of data is created from usage and creation of energy, usage of water, and as well as collection of water. And so we could increase the efficiency of our operations by incorporating smart devices, etc., in our operations of of water and energy. So going back to sewage, another place where data science could be used is by putting in IoT devices in sewage to figure out information about the sewage that then you can put intervention or policies to either reduce sewage or to have better outcomes from the sewage data. An important place where we do need to use data science and AI is in the production of food and food security on the continent, right? So the continent needs to be food independent, so nutrition independent. So how can we improve quality and the quantity of produce on the continent? One is through precision agriculture, where we put an intervention in farming that is precisely for the area and the crop where you're putting in the intervention. So you could, for example, go to a certain piece of land, a small piece of land, and say and figure out what is the soil quality, what is the climate, in that area or the weather patterns over the next period, as well as the crop that you're planting, to make decisions on that area. And therefore, you don't treat one area next to another area the same way, but you treat them based on the quality or the characteristics of the area. And so precision agriculture can improve both the quality and the quantity of produce from farming. You can, of course, put in sensors to figure out where diseases taking hold in crops, looking at soil quality as well as weather, right? And this is already happening across the world. You could put an intervention through artificial intelligence bots that will tell you that can actually help you, pick fruits, etc. Interestingly, there was a news article or news program on BBC which showed these drones going around and picking fruits. So what the drones would do is it would identify whether fruit was ripe or not, and then would swoop in and pick the fruit. But there's other issue with regards to employment, etc. But what it can also do is to bring the cost of agriculture down so that food becomes affordable for more people. So, but there's always a trade-off, right? And of course, data science and artificial intelligence is used to figure out weather patterns, looking at historical data, to figure out what future weather patterns would look like, and therefore put an intervention whether you need to, for example, you need to pick fruits so you produce earlier than later, or to leave it to ripe more or not, right? And there are various other interventions that you could put in based on weather patterns. Climate is a big topic everywhere, right? In fact, it's such an important topic for us at Stellenbosch University. We are launching the School for Climate in the next few months, similar to the School for Data Science and Computational Thinking. We believe that we need to understand climate and put an intervention so that we can improve quality of life here on the continent. And data has a big part to play in this. So of course, I talked about weather patterns already. Forestry and climate are highly interlinked. And so, one could measure the amount of forest cover using artificial intelligence. There was an article that was sent to me by Nico Elema from SU International, where they talked about drones mapping out the forestry in Africa, right? And in fact, the amount of forest cover that they mapped using drones was much more than what they had thought, or quite a bit more, not much more, but quite a bit more than what they had thought when they had counted the amount of trees in Africa, because the drones were able to pick up trees through its and then through image processing, pick up trees all over the Sahara, etc. Right? Then, of course, carbon emission is big, and by measuring the amount of carbon in the atmosphere and using that data, we could put an intervention for carbon emission, and artificial intelligence and data science is already used widely in wildlife conservation. It's been used in rhino poaching in South Africa at the moment. It's also, you can use drones to figure out where poaching is most common and figure out where the intervention needs to happen. So to give an example of this, I had a professor at University of Virginia who was doing research on security on different parts of Baghdad, right? And they could predict with some accuracy where the next device would go off, a bomb, for example. And so similarly, you could use the same kind of technology and data science and machine learning methods to figure out where poachers would most likely hit next, right? And therefore put in interventions. Of course, the problem with these kind of interventions is the poachers get clever as well, and then they change their behavior accordingly. So one needs to be always one step ahead of the poachers. And that's true for viruses as well, right? So as you find solutions for viruses, you find new variants which take holes. And so you've always got to be one step ahead. And artificial intelligence and data science and machine learning, etc., can be useful in being one step ahead of in all these spheres. So those are just examples where I believe data science and artificial intelligence could be used to improve what I say broadly as quality of life, because ultimately that's what we want to do. I want to talk now a little bit about the school, right? So the school was launched at Stellenbosch University in July 2019 by the rector, Wim de Villiers. It was launched with a vision to be a world-class institution in data science and computational thinking in and for Africa. And like I had mentioned earlier, it's not a school for data science, period. It's a school for data science and computational thinking. And so if you look at most other schools for data science, they don't incorporate the computational thinking part. And we had on purpose incorporated computational thinking. So it's how we communicate with the computers to get the outcomes that we want, right? That's a broad way of saying what computational thinking is. And we don't believe that one could do data science without considering computational thinking. Because ultimately, it's a conversation between data, humans, and machines, right? And so that's something unique about the school. And the second unique factor, which is probably more important, is, or as equally important, is the way the school was designed. So if you look at those 10 blue lines, the vertical lines, those represents the faculties at the school at the university. So the School for Data Science is the faculty level schools. So most schools that you find are either inside a faculty or inside a department, which is itself is inside a faculty. But this school, as will be the School for Climate, sits outside all faculties. So sits at a faculty level. So that tells you how important Stellenbosch University considers the growth of data science, both at the university and for the benefit of the continent. Same with climate. And it sits kind of horizontally to all the faculties. And it coordinates various research and teaching activities between the faculties on data science and computational thinking. So if you imagine that we have lots of expertise, which I shall go through, I think, in the next slide, at the university, so we have expertise in developing the science of data science, as well as data that is being generated in the various faculties. This design allows us to bring the two together to improve the quality of research and quality of outcomes and quality of teaching at the university, and in fact, in South Africa, and the world. So what expertise do we have here at the university? So we have people who are doing data science and applied maths. So they look at the mathematics of data science. We have people in bioinformatics who are looking at computational biology and who look at genome sequencing and the analysis of that. We have people who are specialists in computer science, both in the data science part and in the computational thinking part. We have experts in both data science and computational thinking in the Faculty of Engineering, as well as in the Department of Information Science and Statistics, which is a really integral part of data science. So much of this here is, they deal with the science of data science and some with the application of data science. But then you can imagine there are faculties at the university that generate a lot of data. So the Faculty of Agriculture generates a lot of data. The Faculty of Medicine and Health Sciences, for example, generate a lot of data. The Faculty of EMS, Economics and Management Science, generate a lot of data, economic data, financial data, etc. So the design of the school allows us to bring people together, both who generate the data and who need it applied, as well as the people who understand the science of data science, together to improve the quality of research and teaching. The six entities that I mentioned here, both departments, academic departments, and faculties, they do both, research in the science of data as well as the application of data. I just wanted to mention that. When we launched the school, and the school was funded by the central budget of the university, in other words, from the rector and the vice rectors of the university, they also decided to fund a couple of other things. They funded 2 research chair and a data scientist. So we have a chair in Internet of Things that sits in the Faculty of Engineering, and he works with the School for Data Science. He's joined the university last year, and he's already doing lots of wonderful stuff in the space. They also sponsored a chair in big data, which we are yet to hire. And this person will then bring in and build capacity in big data at the university. The school is also, not the school, the university is also funding a data scientist microbiome research. So this is the research, for example, in small biome, such as soil microbiome or the gut. So this data scientist is shared between the Faculty of Agri-Science, Faculty of Medicine and Health Sciences, as well as the School for Data Science, to understand microbiome better and to take in cross-disciplinary research and infuse into the various different parts of that microbiome research. Right? The School for Data Sciences has also got sponsorship to institute some research chairs. So Standard Bank is sponsoring a research lab where we will hire a research chair in machine learning, and part of the responsibility of that research chair is also to look at data science for good. So in other words, for social good. Then Capitec is also sponsoring a research chair in the artificial intelligence for finance and banking. So these are quite exciting stuff, because we are able to then interact with industry directly, figure out socially engaged research, socially meaning either industry or community engaged research, and bring it back to find solution in academia to improve the quality of either industry or communities around South Africa and Africa. Similarly, we'd be looking for research chairs in telecoms, in water, in health, in agriculture. This is not exhaustive list. I'm just mentioning some things here. And I would like to get research chairs that looks at data science in these various spheres of industries, right, or these various sectors. The School for Data Science has recently approved a whole lot of joint appointments. So these joint appointments are employees who sit and shadow between existing departments and faculties of the university as well as the school. So we have a person in South African Wine and Grape Research Institute, in forestry, in plant pathology, in biometry. We'll have people at the business school, which is the University of Stellenbosch Business School, or USB, in economics, in industrial engineering, etc., etc., etc. Now, if you look at that list, we'll be hiring people from lecturer level all the way to full professors. So we'll have a professor in information science or information systems, as well as at the USB, and we'll also be hiring a whole lot of postdocs. Some of these postdocs are already hired, some of the lecturers are already hired, and we are just sorting out the appointments to be shared between the school and the various departments and faculties. So once these people are in the school, we'd have various expertise existing in the school that can then have conversations and improve research in in various disciplines and sectors, right? And also it allows us to infuse knowledge from one discipline to another. because you find that, methods developed in the one discipline is quite useful to another. And I kind of did that. I studied engineering and took some of that knowledge and taught and researched in banking and finance for the last 9 years, or the 9 years prior to joining Stellenbosch University. So it's through cross-disciplinary research that I think we can improve our research and our research outcomes. And this is one way we plan to do at the School for Data Science and Computational Thinking. The school also has access to various research fellows, right? These are research fellows who exist or who have full-time employment at universities and institutions outside the university. And they exist across the world. I've listed some of them here. And they have various expertise they bring to the school. So, for example, Dr. Todd Reed is at the Massachusetts Institute of Technology Media Lab, and he's also got a position with Harvard University. He's an epidemiologist who incorporates data science and cell phone or smartphone technology into improving health outcomes. Then we have Dr. Alan Rabinowitz, who's at the University of British Columbia. He's also co-founder of FEMI Systems, which is a data management and governance system. Dr. Louis Duplessis, he's a South African who was doing his postdoc in computational biology at Oxford University, and he should be moving to ETH Zurich in the next few months. And Dr. João Pires de Cruz is the Vice President of Portuguese Data Science Association. He applies data science in financial models, etc., etc. Let me not go through them. I've just listed 9 people here from various disciplines or various application areas and various theoretical areas, just to give you an example of it. But there are about 15 research fellows, and they're growing quite fast. And so we are able to call these research fellows to be able to provide their expertise in supervision, in building research expertise, and for consultation here at the School for Data Science and Computational Thinking. The school, in its 1 year of existence, has also collaborated a lot. So we have an international collaboration where we applied for some National Institute of Health grant at the end of last year and the beginning of this year. This collaboration is with Mbarara University of Science and Technology in Uganda, Makerere University in Uganda, University of Ibadan in Nigeria. Sorry, that should be Mbarara in Tanzania, not Uganda. And Harvard University in the US and MIT in the US. And this is a collaboration with the Faculty of Medicine and Health Science, as well as the School for Data Science. So let me tell you what this grant application is about. We want to build a data commons, in other words, a large database that takes in clinical information, as well as other non-clinical information like environmental information, store it in a database and look at risk factors associated with non-communicable diseases for people living with HIV, as well as people not with HIV. So if you think about people living with HIV, about 20 years ago, the medication for HIV was probably not so good. And now the medication is quite good, and ARTs have been rolled out. So people are living longer and having quite a similar life expectancy to people who don't have HIV. So we went from wanting to create medication for people with HIV to now thinking about the other diseases that are affecting with people living with HIV. So diseases like diabetes, mental health, cardiometabolic diseases. So we want to look at how do these diseases affect people living with HIV. And one way to do that is looking at data that we want to bring together that already exists and that will be created for people living with HIV and people not with HIV, and then analyzing the data and then looking at what are the risk factors associated with people with HIV for these diseases. And the non-communicable diseases that we're looking at is cardiometabolic diseases and mental health for now, but we'll of course expand it to other non-communicable diseases, and we'll expand it to other countries outside of Tanzania, Uganda, Nigeria, and South Africa. But this is a good example of collaboration that is international, that brings in expertise both from Stellenbosch University and outside of Stellenbosch University to look for better outcomes for citizens of this continent, so people who are living in this continent. And so that's quite exciting. I've had conversation with the University of Virginia in the US, and part of the reason why there's collaboration there that exists because I had studied there, and I wanted to bring some of my collaborators into interesting conversation that they are having already there, and bring that expertise into the university. United Nations had reached out to me for some collaboration on developing curriculum for data science. African Union Development Agency is, they are instituting or launching a Center for Excellence in Science, Technology and Innovation at Stellenbosch University. And we've had some conversations with them. There's, of course, the Standard Bank and Capitec Chair that I talked about, and we've had conversation with FEMI Systems. Right.
Prof, sorry, this is Corina.
Hi.
I just wanted to alert you to the fact that we're coming up on 1 o'clock.
Okay.
Cool. I knew that you were going to run over maybe by a few minutes, but we've got quite a few lovely questions. So I also would like to get to those.
I think I'm either on my last slide or next slide is my last slide. So it's perfect timing. Thank you. Sorry, I've got 2 slides, so I lied, sorry. So we have various teaching programs here. We have the undergraduate Bachelor of Data Science. We have the Data Engineering, which is an undergraduate electrical and electronic engineering degree. And then we have postgraduate degrees in industrial engineering. In data science, we are launching Masters in Machine Learning and Artificial Intelligence, I believe, in the Applied Mathematics department. We have undergraduate and postgraduate degrees in bioinformatics, and we have degrees in data science and computational thinking offered by information science, computer science, and the Department of Statistics. So these are all the various programs offered at the university to build capacity in data science and computational thinking. We launched the African Data Science Academy, and in fact, the African Doctoral Academy was really an integral part of this. The mission is to build capacity in data science and computational thinking in South Africa, Africa, and the world. And we've offered various short courses. We invite you to look at our website when we start offering more short courses this June, July. And if there's any short courses that is of interest to you, you should think about taking them, or suggest to us short courses that might be interest to you and to your institution. We also launched the Technopreneurship Center with the Launch Lab, which is located at Stellenbosch University. The idea is to take graduates and give them practical skills in data science, or real world skills in data science to be job ready. So there are, the last 3 slides. So sorry, Corina, I'll be quick. So there are various opportunities for Africa in data science, right, and computational thinking. First of all, we have a young population, right, and data science and computational thinking is really about capacity development and the cost of computers or servers, right, and so we can quite rapidly build skills in data science and computational thinking among our population to service the global market in data science and computational thinking. And there's a massive demand for data scientists. In fact, I think our president had mentioned that we need to build capacity of 1 million data scientists, if I'm not wrong, by 2030. And I'm sure this capacity need exists across the continent. So there's an opportunity for both the school and for those outside the school to build capacity in data science. We want, there's opportunity to build partnership to solve real problems facing Africa. So there's no reason why we don't have the human capacity on the continent to solve this problem, our problems, and we can partner with both local institutions as well as external institutions to solve these problems. And these are problems in governance, in education, in resource management, in retail, as well as the myriad of different discipline areas that I mentioned before, things like health, energy, water, agriculture, etc. What are the opportunities for institutions outside Africa? And if you look at my previous slide and this slide, it's the same slide except with the heading change. So first of all, we have a young population. So Africa is the future of the world, I believe, right? So I think there's opportunity for external institutions external to Africa to collaborate with us to develop solutions for the world. We could provide the data scientists for the world because we have a young population. And remember, these data scientists don't have to leave the continent. They could service the external market while living in Africa. And we see that especially work from home, right? I mean, I do almost all my job while staying at home. We can build partnership with external external institutions to solve Africa's problem. So if you look at how COVID-19 was managed in a lot of African countries, like I think it was Senegal is the one that comes to my mind. It's either Senegal or Ivory Coast. There are things that we can learn about how COVID-19 was managed in that country versus the rest of the world, right? So we can take our skills and educate the rest of the world. And I think there are in multiple areas that we can do that, from medicine to conservation, etc. And this is in governance, education, resources, etc. My last slide, right? So I do want to go back to opportunities in health, because I think this is health and agriculture are the most immediate needs, and I just wanted to highlight health, right? So I talked about the African-wide health database for non-communicable diseases, which is a grant application that we had put in with 3 institutions in Africa, as well as 2 in the US. I think we need to build an Africa-wide health database so that we can use data scientists and clinicians, bring them together to solve our health problems in Africa. I think we should think about cross-border medicine, which I talked about earlier. I talked about why we could be the leaders and ethics standard for health and data science in the world. And we could use data science to improve research and education outcomes in health as well. So these are the things I think we should focus on almost immediately. Of course, there are other things, right? There's equally important agriculture, climate, all those other great things that I mentioned about earlier. I just wanted to mention health as one standout point, but those others are equally important. And but I do think there are some that are more important than others. And I want to mention that again: health, agriculture, climate, water and energy, etc. Right? Thank you so much. That is the end of my speech. Oh, sorry, before I go, we do have a Women in Data Science conference in June 2021. Please keep a lookout for it on our website. We want the number of women in data science at the moment across the world is quite shocking, and we need to bring in more young female population into the field. Women in Data Science is a conference that was instituted in the US initially, and now it has spread across the world, and we want to be part of that change in the school. This conference will happen in June 2021. All the speakers, panelists would be women, and we invite women from academia and industry. It will probably be a half-day conference on the latest things, how research that is happening in data science and both in academia and industry, or intervention in industry. Please keep a lookout for this. This is an exciting conference that we hope to bring in June 2021. With that, I shall say thank you. Thank you, everyone. That's the end of my talk.
Thank you, Prof.
This is my contact details. Please do contact me if you have any questions.
Amalsha just shared the presentation in the chat, so everyone can download it directly as a file. So Prof, thank you for the informative session. Let's see if we can answer all the questions that we got through the chat. If we run out of time, we can either invite people to stay on a little bit after the formal session if they want to chat, or I can also forward it to you by email. I've got everybody's email addresses. So our first question comes from Marcus. I think this is a colleague at Stellenbosch. He asked, I can also post it in the chat for you. When deploying a neural network to evaluate a problem, how does the possible node space before training the network compare to the size of the probability space of the problem?
Can you repeat that question again?
Yes, I'm also posting it in the chat.
Oh, sorry, let me look at the chat.
And this is from Marcus.
I can't see the chat on here, or maybe if I click on participants and then chat. No. Let me stop sharing and then.
Yep.
Okay. When deploying a neural network to evaluate a problem, how does the possible node space before training the network compute the size of the probability space of the problem? How does the possible node space before training a network? Well, I mean, how does the possible, you talk about the probability of node space before training compared to the size of the probability space of the problem. Is that what you're saying?
Marcus, you're welcome to unmute yourself if you would like to clarify your question, or you can add to the chat.
Marcus, I think you're asking how does the probability space change as a result of training?
Oh, apparently
Is that
Mark
it?
can't unmute. Marcus, do you mind? Let's go on to the next question. If can you just question a bit more? Can you just elaborate, please, on your question? Okay, so
I can't read any of the other questions because my windows are small, so you might have to read for me.
Okay,
That's
no
okay.
problem, Prof. So a colleague from our Institute for Future Studies, Dr. Jerry Mogiru, asks, how are possible issues of AI and machine learning bias managed, particularly in remote and precision medicine?
This is a really good question, right? So there is bias that exists not just in medicine, in multiple areas. And the problem with data science or data is, we build these models using existing data, and the bias is already, it's incorporated in the data. So the one way is for people who build models to be very careful about how these biases do come out and maybe test for them. But I think it would be impossible to test for all biases just because data inherently contains bias. I mean, I'll give an example. There was a case when I think I came for the interview at the School for Data Science when one of the Apple companies, directors or some senior person had applied for credit, and he got better credit than his wife, who actually had a better credit history, right? And because there was biases in the data that was used to train the models, these came out in the models itself. So I think we need to be careful about how we use these data and bring out the think about biases when we build these models. And this is where the ethics of data science in health becomes really important, given that you're alluding to health, because we know bias is a problem. And so how do we come around these bias, and what are the checks that we can do to reduce the bias in our models? I don't think we can get rid of them fully. I mean, I don't have a clear answer for you. I think it's something one has to consider when building these models.
Wonderful.
Sorry, and can I just say one more thing? And also training the data set in a wide range of scenarios, right? So if you only test your data set on, let's say, a European population, that might not give you the answer that might not give you the optimal answer for population in South Africa, for example. So we need to be careful on the distribution of the various characteristics of the people or the individuals or the data set that we train the model on and build the model
on. Our next question, Prof, is from Stephanie Spitter. Welcome back, Stephanie. So we're looking at data science or analysis as part of natural science curriculums. If one is interested in studying data science, how does one decide to study? For example, physics with an emphasis on data science as the natural sciences faculty, compared to data science in the computational faculty?
Okay, so that's a great question, right? So historically, what would happen is people will study, for example, computer science or statistics, and they might double major with physics if they had an interest in physics. And what the kind of person that enters a physics degree is one who wants to apply and think about physics problems, right? They might not end up doing that when they graduate, but that's their initial plan. And so what you want that person to do is to both pick up physics as well as data science. And so at the university, we have this really great degree that started this year, Bachelor of Data Science, that allows you to create focus areas such as genetics and logistics, etc. And physics might be part of it, I'm not sure, but we plan to expand on that. And so that person or graduate of that degree would learn both the application areas such as physics, as well as the methods in data science. And that's the most powerful combination, right? Because if I don't think it's always great to have only data science knowledge, but not the application area knowledge, because there are nuances in the application area. But sometimes, of course, it's good to also have those people who are not experts in the application area, application field, because then they don't bring in the biases. But when you look at the final solutions created by data scientists, you have to bring in an expert in that field. So I cannot build a data science model for epidemiology without bringing an epidemiologist into the picture, because they will know the nuances about disease spread, etc. So I would suggest learning data science in a physics degree, right? But I think now you have these degrees where you major in both, right? And that's the beauty of it.
Thanks, Prof. So Marcus has come back to us on the first question. He's saying, I'm thinking about the size of all the possible configuration that the neural network nodes can take on. How many different neural networks can you have versus the complexity of the problem that you are trying to solve?
Oh, okay. So if you think about it, I mean, it's really, the neural network is really, the design of the neural network is really problem dependent, right? So if you think about a large number of nodes, I mean, this is quite a technical question for this talk. If you think about a problem with a large number of nodes, there's large number of configuration, right? So if you think about like a social network like Facebook, right, and you take a population of 1,000 or let's say 1,000,000 people and you create a network around that, you could create a network of 1,000,000 nodes, or you could create a network of smaller number of nodes where there are characteristics common. You put in people who are common in characteristics into one node. And it really is problem dependent rather than, problem and efficiency dependent rather than deciding upfront, or I only want to have a small number of nodes or a large number of nodes, because it depends on accuracy and what you're trying to figure out, right? I don't think that's an easy answer, at least the way I'm understanding your question. It really is problem dependent.
Thanks, Prof. Next question, we have a handful more, and I hope we can all get through them. So Kim, who I think is a colleague here at Stellenbosch, has asked how they can get involved. Sorry, my thing just scrolled, with a new climate science school, especially if they already have existing work that is related. And she also would like to know if there's scope for short collaborative projects with members of the school. It would be useful to be able to work alongside people with more experience. So I think that speaks to your sort of the spirit of collaboration that you were also talking about.
Okay, so thanks for that question. So there are two parts to that question. One is about the climate school. And so it's hard for me to answer about the climate school because it hasn't launched yet. And what I would do is look out for news, articles from Stellenbosch University or announcements from Stellenbosch University about the new school for climate and when it will get launched. And then you could, contact the relevant person at that point, the director at that point, to see where the collaboration could happen. Already, we are going into multinational collaboration with universities in Finland, Russia, University of KwaZulu-Natal, and us, which looks at climate and how data science could be used in climate. And our role is to build a MOOC, a massive open online course on using blockchain for climate, right? So there are conversations already happening with us and climate, but not at the university. It's with people outside the university. So the first part of your question is keep a lookout for those announcements from the university, and then you could reach out to the director of that school when that is launched. The second part of the question is how can you collaborate with us for short projects? The answer is to contact me, and then we'll see what is possible. Now, we have people in those joint appointments. They could work in terms of in consulting capacity, or they might want to get involved in research capacity. It really depends on their time and their capacity to get involved in more projects. But these are the kind of requests that we want, because we want to be useful to the rest of the university as well as to the data science application people out there in the country and the continent.
So I see Kim also had a follow-up question at the time. For someone that is from a non-traditional data science background, currently working as a postdoc, what opportunities exist for upskilling fast and as economically as possible? I know that you had a winter school, and I think you're probably going to have a winter school again.
Yep. So, if you want to upskill in data science, I think there are multiple different ways, right? So you could go and do, for example, one of these online courses that is that you can find on the web. For me, the only problem with those courses is there's not much of an interaction. And so it's not the same as sitting in a class or sitting online, but having the synchronous conversation and be able to speak to a lecturer or a teaching assistant. You could, of course, do a degree, which is time consuming, and time means money and it can be expensive. And that's a great option for people who are getting into data science and who have the time and money to go get into it. And the third option, which I think is a good option, is looking at our short courses or short courses at other universities and seeing which of those short courses could be applicable to you. So last year we had three short courses: Introduction to Data Science, Introduction to Statistics with R, and Introduction to Cloud Computing. This year we hope to have more short courses, including short courses that focuses on applying data science in health. We won't have a short course, an introduction into data science again, introduction to coding, etc. So what would be useful is to talk to people in the know-how, both in your area, both at the school, and see what we are offering and seeing which of those courses will be the most applicable to you in terms of building your knowledge. Of course, you can't get everything at one go, but these short courses allows you to build things over time at a quite a cheap manner. Particularly for postdocs and PhD students, I believe there is some funding that one can get through various parts of the university, which I'm not familiar with.
Thanks, Prof. So we've got a nice question from Nitesh that is asking, there is ongoing research into exploiting machine learning for predicting criminality. What are your thoughts on this? Additionally, are there prospects for using machine learning to predict racism and prejudice?
So the first one is about criminality, right? So I don't know if you remember that Tom Cruise movie where they would predict somebody with, who's about to commit a crime before they commit a crime. I forgot what it was called. Corina, do you remember?
Minority Report, I think.
Minority Report, exactly. Yes. So can you really arrest a person before they commit a crime? And there's ethics questions around that, right? So let me not get into the ethics of it. Well, I guess my answer is still going to be ethics part, right? So I do think it's useful to use AI to predict where crime is going to happen, right? And where the targets are going to happen, and therefore put an intervention for that. And without AI and data science, I can already say some areas are more prone to crime than other areas. And so, policymakers need to focus on those areas perhaps more than other areas, right? That's one. So you can use data science to target, to figure that out at a minute detail. That's one. Figuring out who's going to be a criminal now, that's got ethical implication because somebody is not a criminal before they commit a crime, right? And if you use historical data, like in the US, there's a high bias data on who goes to jail, etc. in the US. So one doesn't want to be using that data to be building models. One has to be really careful what one means by predicting criminality. So I'm all for predicting criminality where crime is going to occur rather than who is going to commit a crime, because I think there's a lot of biases that comes with the latter. The second part of the question was, Corina?
Are there prospects for using machine learning to predict racism and prejudice?
So to predict racism and prejudice, so I'm trying to understand what that means. So is it to predict whether a statement is racist, or is it to predict whether somebody is going to be racist or a situation is going to result in a racist scenario or discriminatory scenario?
Nitesh,
so just with crime, you can't predict somebody is racist or is going to discriminate before they've actually discriminated, right? And so I think there's ethical implications to that. I think one could use machine learning to predict whether there can be biases, right? And what are those biases? In fact, machine learning can bring in its own biases, right? So I definitely I would encourage looking at how machine learning could be used to figure out if there's biases. So to give an example, in the US, they will use machine learning to figure out if the probability of fraud happening. So probability of some sort of criminal activity. So I presume you can use machine learning to figure out the probability that a particular event was racist or not. I haven't really thought about it and looked into it, but I think there's also a lot of ethical implication that comes around it. But that's what's interesting about AI and data science, that it creates opportunities, but it also creates opportunities for us to think about the ethics of it all. And we need to develop and advance the ethics and the social implication and the legal part. I'm using NIH parlance here, at the same speed as we develop the technical aspects of data science and artificial intelligence.
Thanks, Prof. We have time for one more question. Which means we're going to skip the favorite question. We had a colleague, Joseph Mundadi, who asked if he can join the data school as an intern. So I'm definitely emailing you that and how to organize a proper training session on agriculture and climate science under data science in Africa. So I'll definitely be forwarding that. So our last question is from Marita. She asks, do you have capacity for genomic data storage in order to provide access to students and other researchers for data sharing after ethics approval?
Okay, so I believe the university has access to facilities for genomic storage. We haven't looked at it, partly because the school is still new and we haven't done all but we have an amazing computational biology, bioinformatics group that does this kind of stuff. And so they've definitely got the storage capacity. We've got 2 high performance computers at the university. So we are able to, use that to store as well as for computational power. So the general answer is yes, but I haven't looked at it. But if you contact me, I can put you in touch with the right people.
Okay, so you can contact Prof on dataschool@sun.ac.za. So maybe we do have, is it possible to collaborate with colleagues doing a training session on agriculture and climate science under the?
Yes, okay. That would be very much welcome, because we are thinking about how we can use data science intervention, in this case blockchain, for climate. And so it will all feed into the same set of knowledge and building capacity that we want to do. So yes, so I would welcome contacting me on how we can advance that.
Perfect. Then I quickly have a note from Frida Scheffler. She's working with the Department of Psychiatry, working on neuroimaging data. They've begun looking at using machine learning, but one of their biggest problems is the size of their database. So going back to what Marita asked, before you can analyze, you need data points. Should we be digitizing health data in order to be able to compete with global players like the Swedish birth cohort, etc.?
So, I think the easy answer is yes. By digitizing the data, it allows you to share it wider and have more people analyzing it. Interestingly enough, there is a great call by NIH, a NOC, Notice of Special Interest call, which you'd know better than I do, where they're asking us to analyze existing data, health data that came out of NIAID grants, to look at, so that the data can be more widely used and better used. So I've had some conversations with people in the Faculty of Medicine and Health Science, which Professor Surya Siddharth was part of. Please do contact me. I would like to look at ways that we could collaborate in bringing that to fruition, how we can contribute capacity to that if possible. At the moment, what's happening with the school is, because the school is small and there is a high, I will say, demand in terms of collaboration, it's not possible to do everything that we would like to do, but this is one way of building collaboration. In fact, I had a meeting with Professor Annika Hessling earlier today on TB, or childhood TB, and what we said was, you start off with a small project, and that collaboration can then build into bigger collaboration. So please do contact me on that, and we'll see what we can do to collaborate. That would be lovely. Thank you for that.
Wonderful. So Prof Kanshu, I think we should start wrapping up. It's just before past. Kutsai and Christa Philander, I note your questions, and I'll definitely be putting you in touch with your question for Prof. To everyone that joined us, thank you for your attention. I maybe forgot to say a special welcome to all the ADA alumni that have returned, and then to To everyone who's with the ADA and the School for Data Science and Computational Thinking for the first time, we hope you enjoyed your session. We'll be adding those of you that wanted to our mailing list. We'll be sending out this presentation on email, and also once the recording is rendered, I'm going to put it on our YouTube channel so that you can also share this recording freely with your colleagues and people that you might find interesting. So a big thanks. Please join me in thanking Prof. And we will add everyone to the mailing list as well. Thanks, Krista. And good, so enjoy the rest of your Wednesday. I hope those of you that are on the Western Cape are keeping warm. And yeah, see everyone soon.
Thank you to the ADA for this opportunity, and thank you everyone for coming. Much appreciated. Please do keep in touch and check out our website. Thank you.
Wonderful. Thank you.
Bye-bye.